This recording will cover Parkinson's disease. Parkinson's disease is a progressive neurodegenerative disorder. The four cardinal symptoms of Parkinson's disease are tremor, muscle rigidity, bradykinesia or akinesia, so slow movement, and postural instability. So what's the problem going on inside the patient with Parkinson's disease? There's an imbalance between excitatory and inhibitory neuronal activity, which leads to problems with controlling and initiating voluntary movement. The big neurotransmitter that's having problems with Parkinson's disease is dopamine. And if you remember from pharmacology, we had the saying, no dope in the park, as a reminder to us that the problem with Parkinson's is low dopamine. With low dopamine, which is an inhibitory neurotransmitter, there is an imbalance between excitatory and inhibitory neuronal activity. This low dopamine prevents the patient from being able to refine voluntary movements. Not only does Parkinson's interfere with movement as a result of dopamine loss in the brain, it also reduces the sympathetic nervous system's influence on the heart, blood vessels, and other areas of the body. And if you remember, the sympathetic nervous system, that's our stress, our fight or flight type body response. So if it's decreasing the sympathetic nervous system, it's decreasing the fight or flight response that we would see in our patient. Orthostatic hypotension, low hypotension, drooling, which is more of a digest type of response would be seen, as well as nocturia. Some patients may also have neuropsychiatric symptoms, including mood changes. Parkinson's disease is separated into different stages. Stage 1 is mild up to stage 5, in which the patient is completely dependent. You don't need to know what's going on in each stage, but you do want to understand the progression of the disease. So in stage 1, unilateral limb involvement, minimal weakness, and a hand or arm trembling might be noticed. In stage 2, bilateral limb involvement, a mask-like face, so they don't really show much emotion or expression with their face, and it is again related to how the muscles are working, as well as a slow shuffling gait. Sometimes you hear about a Parkinson's patient having sticky feet, so a lot of times it's hard to start initiating movement, and then they start going, but sort of a slow shuffling gait. Stage 3 would be moderate disease, postural instability. A lot of times the patient is leaning forward when they're walking, and that obviously puts them at risk for falls, increased risk of falls, and also increased gait disturbances. Stage 4 with severe would be akinesias and rigidity. And again, both of those are part of the four cardinal symptoms of Parkinson's disease. And finally, stage 5 would be complete ADL dependence. In terms of assessment, when obtaining the patient's history, collect data related to the time and progression of symptoms noticed by the patient or family. Sometimes patients can disregard the symptoms as just normal signs and symptoms of aging, so we want to follow up on any signs and symptoms they have noticed. Tremors are usually noticed in the upper extremities first and may increase with stress. Slow voluntary movements and reduced automatic movements may be manifested by a change in the patient's handwriting. I did watch a video of a gentleman who was diagnosed with Parkinson's, and he said his first clue was when he started having problems with his handwriting. Some patients report freezing because they feel like they're stuck to the floor. So we talked about the sticky feet already. I remember taking care of a gentleman who was very slow to get up out of the chair and to start walking with his walker. I mean, just taking that first step felt like it took forever, and eventually a second step. And as he started moving, he got a little momentum going. He was still slow and shuffling, but he was moving. But when we had to then change direction, turn to the left to get to the bathroom, that change, he had to start all over again. So he had those sticky feet again. It took him a while to get started. Assess the patient for rigidity or resistance to passive movement of the extremities. It can be classified as cogwheel, plastic, or lead pipe. Cogwheel is manifested by a rhythmic interruption of muscle movement. Plastic is defined as mildly restrictive movement, and lead pipe would be total resistance to movement. Observe the patient's ability to relax a muscle or move a selected muscle group. Watch the patient's gait and posture, which is often unstable. A lot of times, like we said, they're leaning forward, their heads leaning forward, and look at their ability to ambulate, whether with or without ambulatory aids. So looking at the patient's facial expressions, many Parkinson's patients will exhibit a mask-like face, is what it's called, with wide open fixed staring eyes, and they're not very expressive. They don't show much emotion with their face, and that's due to the rigidity of the facial muscles. And you have a picture in your textbook about this. But so if you're thinking about this, the patient has a condition where the muscles aren't working right and they can't smile or do things that they normally would do because of the muscles not working right. And we're talking about muscles, on the face, in the head. What other concerns might you have? What I'm trying to get at is difficulty chewing or swallowing. So we got safety issues for your Parkinson's patient because of their unstable gait. They're at risk for falling. And then because of the problems with rigidity of muscles and problems with chewing and swallowing, we're worried about aspiration and choking. Some patients also have uncontrolled drooling. Some patients develop dementia as the disease progresses. In addition to worrying about choking and aspiration, we worry about inadequate nutrition, right? It's difficult to eat, so I'm just not going to eat as much. We want to worry about that with our patient. Many patients experience autonomic nervous system symptoms, such as excessive perspiration and orthostatic hypotension. Watch for emotional changes. Makes sense, right? If you were going through this, depression, irritability, apathy, anxiety, and insecurity. Changes in speech patterns can occur. The patient may speak very softly, slur or repeat their words, or use a monotone voice or halting speech, hesitate before speaking, or exhibit a rapid speech pattern. And again, the one gentleman that I really remember well, who I took care of, who had Parkinson's, who was slow to stand and then turn. When you'd ask him a question, it took quite a while for him to start answering you. So it's important as nurses that we don't, rush them along, like answer questions for them. Is that what you want to say? Give them the time to actually get out what they're thinking, because it will come. It's just a little slower and sometimes a little softer or with halting speech. Bowel and bladder problems are commonly seen in patients with Parkinson's disease as a result of the malfunction of the autonomic nervous system, which regulates smooth muscle activity. They can have either urinary incontinence or difficulty urinating. Constipation can occur because of slow motility of the GI tract or because of poor dietary habits and poor fluid intake. There are no specific diagnostic tests for Parkinson's disease. The disease of Parkinson's is made based on clinical findings after other neurological diseases have been eliminated as possibilities. Analysis of cerebrospinal fluid may show a decrease in dopamine levels. Other diagnostic tests may be done, such as an MRI or SPECT, a single photon emission computed tomography, to rule out other CNS health problems.